Blood in urine can indicate a more serious underlying condition, such as prostate cancer. BPH can also lead to sexual dysfunction, including erectile dysfunction. A weak urine stream can be annoying and cause the bladder to seem as though it isn't emptying all the way. It can lead to risk of bladder stones and urinary tract infections, as well as incontinence or urine leaks. Welcome back to Medical Made Easy. Today in this video, we are discussing the signs and symptoms of an enlarged prostate, which are important for you to know. Prostates are small, walnut-sized glands that are located just below the bladder. As you age, your prostate may become larger. BPH, or benign prostatic hyperplasia, occurs when it becomes large enough to create issues. It is important to note that BPH is benign, meaning that it neither causes cancer nor it is a precursor to it. However, BPH and cancer can occur together. Men who are overweight or obese are more likely to experience erectile dysfunction, who are not active and have an enlarged prostate gland. Now, let's talk about the signs and symptoms of benign prostatic hyperplasia. The first symptom of BPH is urinary frequency, or the need to urinate frequently, especially at night. This is caused by the enlarged prostate glands pressing on the urethra, which makes it harder for urine to flow out of the blood. As a result, the bladder contracts more frequently, and men with BPH may feel the need to urinate even when their bladder is not fully filled. Urinary frequency is a prevalent symptom of benign prostatic hyperplasia and may indicate the first stages of the illness. However, it can also be attributed to other medical disorders, such bladder stones or urinary tract infections. Urgency, or the sudden and intense need to urinate, even when the bladder is not full, is the next common sign of benign prostatic hyperplasia. This is caused by the enlarged prostate gland pressing the urethra, which makes it harder for urine to exit the bloodstream and causes a sense of urgency. BPH males may have an overwhelming urge to pee and may find it difficult to hold off on urinating for extended periods of time. Urgency can cause disruptions to everyday activities, anxiety, and a worse quality of life. It can also result in incontinence or pee leakage if the individual is unable to go to the restroom in time. Urgency is a common symptom of BPH and may indicate the illness is in its early stages. However, it can also be caused by a variety of other disorders, including bladder stones and infections of the urinary system. Urinary flow may be sluggish or weak, particularly in the early phases of the urge to urinate. This inability to completely empty the bladder might result in urinary retention. A weak urine stream can be annoying and cause the bladder to seem as though it isn't emptying all the way. It can also raise the risk of bladder stones and urinary tract infections, as well as incontinence or urine leaks. Urine flow interruption is another significant indicator of an enlarged prostate. If urine flow breaks multiple times while you are urinating, this means that your urethra is partially blocked. Other possible causes of this issue include pelvic muscle problems, infections, or inflammations of the prostate nervous system, and occasionally surgical side effects. The next crucial indicator is the inability to completely empty the bladder. Men with BPH may find it difficult to empty their bladder, which can result in urine retention, especially in cases where there is dribbling after urinating. This is because the enlarged prostate gland presses against the urethra, making it harder for urine to exit the bloodstream. As a result, some BPH patients may feel as though they have urine in their urethra after they have finished urinating. Dribbling can cause embarrassment, raise the risk of skin irritation and urinary tract infection, and result in incontinence or urine leakage. Once again, worthy of repetition, the accumulation of urine in the blood caused by BPH can increase the risk of urinary tract infections. Men with BPH may also experience pain or burning when they urinate. The next important sign is the blood in urine, also known as hematuria, which can indicate benign prostatic hyperplasia. Blood in the urine can range in color from light pink to deep red due to irritation and inflammation in the urinary system caused by the prostate gland pressing on the urethra as a result of BPH. Blood in urine can indicate a more serious underlying condition, such as prostate cancer. Last but not the least, BPH can also lead to sexual dysfunction, including erectile dysfunction. In certain cases, the presence of blood in urine may only be detected through a urine test because the amount of blood may be small and not visibly noticeable. However, in more severe cases, the blood in urine may be noticeable and accompanied by other symptoms, such as pain or discomfort during urination. Some men may only have a few symptoms, so it's important to note not all the men with BPH will experience all of these. If you are experiencing any of these symptoms, it is important to see a doctor for evaluation and treatment. Your prostate may enlarge with age. BPH occurs when it becomes big enough to be problematic. It is important to note that BPH is benign, meaning that it can neither cause cancer nor it is a cause of cancer. Still, BPH and cancer can occur simultaneously. Let's start by discussing the risk factors. There are many risk factors for BPH, but some people are more susceptible than others. These include men over 50, as the risk of BPH increases with age, men whose father had BPH, people who are overweight or obese, people who don't stay active, and some men who have erectile dysfunction. Next, let's discuss the signs and symptoms of BPH. Urinary frequency is the first sign of benign prostatic hyperplasia, which is the need to urinate frequently, especially at night. Men with BPH may experience frequent bladder contractions even when their bladders are not fully full. This is one of the most common symptoms of BPH and may indicate the early stages of the condition. But urinary tract infections or bladder stones can also cause the frequent urination. This is because the enlarged prostate glands press against the urethra, making it harder for urine to flow out of the blood. The subsequent prevalent indication of benign prostatic hyperplasia is urgency, characterized by a sudden and intense need to pee even in the absence of a full bladder. Incontinence or the inability to pass urine is another important symptom of an enlarged prostate. If your urine flows intermittently during urination, it means that your urethra is partially blocked. It is important to emphasize again that dribbling can cause humiliation, result in incontinence or pee leaks, and raise the risk of skin irritation and urinary tract infections. The accumulation of urine in the blood caused by BPH can increase the risk of urinary tract infections. Men with BPH may also experience pain and burning when they urinate. The next important sign is blood in the urine, also known as hematuria, which can indicate benign prostatic hyperplasia. Pressure from the prostate gland pressing on the urethra due to BPH can irritate and inflame the urinary system. That's all for today. I hope you find this video helpful. Don't forget to like, comment, and subscribe to this channel. Some men may only have a few symptoms, so it's important to note that not all the men with BPH will experience all of these. If you are experiencing any of these symptoms, it is important to see a doctor for evaluation and treatment. Until next time, bye-bye.